Big news. The FDA has just approved the medication Zepbound for the treatment of moderate to severe sleep apnea in adults with obesity. This is huge. Oh my gosh, this is huge. First of all, you may be saying, what is sleep apnea? Obstructive sleep apnea is a condition where when the person lies flat, their airway becomes blocked, and thus they stop breathing, usually many times at night. The problem with this is it can lead to being tired during the day, headaches, and other symptoms. But in addition to that, sleep apnea can be a risk factor for things like high blood pressure and right heart failure and so many other things. Getting diagnosed with sleep apnea if you're at risk and then being treated for it is huge. And we have not had any medications FDA approved to treat sleep apnea. That is big in and of itself. But the other part of it is that Zepbound is, again, the drug made by Eli Lilly. That is the version of tirzepatide that is approved for obesity. It helps people lose weight. But there's also a version of tirzepatide called Mounjaro that's approved for diabetes. This is a GLP-1 agonist. These medications have helped so many people control their diabetes, but also control their weight. There are a lot of benefits here that I see. As a family doctor, I am hoping that this really helps patients with sleep apnea and obesity. We know that Zepbound helps people with obesity. We know that. But I also hope that it helps people get coverage for this medication and others, because that is one thing we desperately need. But as we can see here, many of you guys are asking, well, how does Zepbound actually, decrease or improve sleep apnea? Well, it's an excellent question. The idea here is that Zepbound helps you lose weight, and sleep apnea often happens in patients who are obese or overweight. Now, let me say, it does not always happen in people who are obese or overweight. You may be a normal weight and still have sleep apnea. However, a lot of people are obese or overweight, and with Zepbound helping people to lose weight, studies have shown that this also helps people sort of improve or lower their incidence of sleep apnea. This is a really, really big deal. Let me know, by the way, in the comments if you're already on Zepbound, if you have sleep apnea, if you've noticed that since you've been on Zepbound or any other GLP-1 agonist that your sleep apnea has gotten better with losing weight. I'm curious. Please write in the comments. Hopefully, this indication will help us get more coverage for a drug that will help, I suspect, a lot of people.